Hey guys, it's Dr. Emily from Greenway Chiropractic. With me today I have Ryan. I actually met Ryan at the gym and we just got into a conversation about the nervous system. But Ryan, just tell your story a little bit about how, your experience here at the office has been a little bit different than what you expected. And then, yeah.
Well, okay, so I've been going to a chiropractor. I went to a chiropractor probably for 14 years growing up. I was an ex-gymnast. And it was one of those things where he was a family friend, you go in and get your back cracked, and that was pretty much the extent of the program. And while I did gymnastics, I actually broke my back vaulting, which I actually didn't find out until I came to Dr. Emily's office. And it was an injury that was reoccurring and constantly inflamed. And going to that chiropractor growing up, it never fixed anything. And so when I came to Dr. Emily's office, it was a completely different approach to chiropractic care than I was used to, with a focus primarily on optimizing the function of the nervous system. And they had a system that they used that was quite a bit more comprehensive than what I was used to. So you come in and you do warm-up exercises so that the adjustment is actually going to take, and especially somebody like me who is very active. I train twice a day doing anything from weight training in the gym to aerial arts and aerial silks at night. And so everything gets very tight very quickly, and having that warm-up at the beginning helps to loosen that up before the adjustment. Otherwise, nothing really is going to move very easily. And so I've noticed just over the last year and a half, it's been probably a year and a half that I've been coming to the office, just tremendous differences, especially in mobility, but across the board, because they've looked at nutrition, they've looked at nervous system health, they've looked at basically a comprehensive health package that has at least from a nutrition standpoint, I've changed a lot of things that I've done, but as a package, it's given a point of view that has been very beneficial to me. Just understanding, why we do the adjustments that they do and the way that they do it, and then having you, set the adjustment at the after it's all been done, and so it seems that. What basically it boils down to is that not all chiropractors are created equal. And so I had almost a bad taste in my mouth from the first 14 years of going through chiropractic care, just because I didn't really have any results. And it was great from trying to manage pain and doing basic maybe myofascial release and that sort of stuff. But I had better results in 2 months coming to a Maximized Living office that had a more comprehensive approach to both health and correction than I had in that entire 14 years. So
really just finding those missing links that were kind of maybe overlooked or just not addressed the first time around.
And I think it's all about the point of view, because a lot of chiropractors, I think, are pain management. They want you to come in, you get your back cracked, and that's the extent of what they're doing. There's not really any precision necessary. There's precision, but it's a different kind of precision than what you guys have developed as a formula from, the chiropractor I went to growing up didn't have the x-rays in front of them. They didn't have, I don't even remember doing x-rays. So it was more just based on lining your feet up.
Yeah.
And so this has been a much more successful experience.
Awesome.
If nothing else, and I've certainly told several people about it too. So.
I appreciate that too. Well, awesome. Thank you for sharing your story too. So, all right, guys, take care.